So we know that PGI of the shoulder is both a diagnostic and therapeutic challenge because of the low virulence of the common organisms we see. C. acnes is our most commonly cultured organism in revision shoulder arthroplasty, followed by coag-negative staph species. And instead of the obvious infection on the right, we very commonly see these occult infections, and this can impact our infection prevention strategies as well. We don't typically see Staph aureus as much in the shoulder, and we know from the literature that C. acnes can persist in the surgical wound despite our standard skin preps and IV antibiotics. So the second International Consensus Meeting on Musculoskeletal Infection was held now 5 years ago, and as a result of this meeting, consensus recommendations were made around prevention of shoulder PGI, and you can see this nice review article that highlights these recommendations. I'm going to go through a lot of this, but also talk about some of the newer literature. So I think these are the perioperative strategies we want to address. Prior to surgery, we want to address our preoperative risk factors that are modifiable. We want to use appropriate home skin cleansing, and then on the day of surgery, we want to have appropriate surgical skin preparation, appropriate antibiotic prophylaxis, and then intraoperative irrigation. So what about our preoperative risk factors? You can see from the literature these risk factors for PGI of the shoulder. We know that young, healthy males have higher risk of C. acnes infection, but if we look at these bolded factors, these are all potentially modifiable. So what does the literature show us about these? If we look first at smoking cessation, this study by Hatta et al. Showed that both current and former smokers have significantly higher infection rate in primary shoulder arthroplasty, so smoking cessation is potentially a benefit. If we look at weight loss, there's conflicting evidence in the literature, but this recent study by Kogan et al. Showed higher BMI is associated with increased complication rates, particularly superficial and deep infection in primary arthroplasty.